Dr. Allison Messina, Dr. Patricia Emanuel, thank you so much for joining us for the Safety Back to School Roundtable. I appreciate you guys taking the time because I know that you are busy.
You're welcome.
Thank you for having us.
So a lot of people, a lot of parents out there, guardians, they're trying to figure out how to send their children back to school. A lot of concerned parents out there. I'm sure that you two have been receiving copious amounts of questions.
Yeah, definitely.
Dr. Messina, I want to start with you. What is the most popular question or concern that you're receiving?
Probably the most popular question that I've been receiving is if our children go back to school, how do we do our best to try to make it as safe an experience as possible? And, and there are certainly ways to do that. Many of us, including people that work in the hospital, have been working throughout this pandemic. And there are some very simple but effective principles that you can apply to this situation that will keep you safe. Number one is mask wearing. We have universal masking in the hospital. And I think that is a key measure to making schools safer, that everyone wear masks. And then hand washing and hand hygiene are always super important, and especially now. So having hand sanitizer available, having breaks where the kids can wash their hands, all of those things will help them be safer. And then physical distancing. And I know a lot of the schools are working really hard on reorganizing their classes, classrooms, and really paying attention to these things.
All good information. Dr. Jeremy Kurtz joining us now. Thank you so much for taking the time to talk with us. Dr. Messina was just talking about one of the most common questions, concerns that she's received. One of them, you said you had noted masks. And when you have teenagers, it seems the mask wearing can be easier. But when you are dealing with these 5 to maybe 10-year-olds, not as easy. Dr. Kurtz, what would you recommend to parents out there? And I can't control every child out there to keep their mask on.
Yeah, well, I mean, the important thing is it's actually pretty easy to teach these kids to wear their masks as long as they see that modeling at home and they get that positive reinforcement at home. I have children, I have a 4-year-old and a 6-year-old, and I don't expect them to be able to wear that mask all day long, 100% of the time, always doing it right. But it's important that they see the way that I use the mask and they understand that they need to use the mask. And honestly, after a couple times, they just get used to it and really don't have a big problem with it. They don't make a big deal about it as long as you don't make a big deal about it.
And Dr. Emanuel, we were talking about vaccines before we all jumped on here, and you were stressing the importance of parents, guardians taking their children to get these vaccines, even before we hit flu season, because that seems like it's another story in itself.
Well, this is right now is back to school time for pediatricians and physicians to assess children for their vaccine status, to get them up to date. There's key vaccines before kindergarten and before ages 11 to 12, the MMR, the Tdap. And so we want to make sure we don't have another epidemic on top of a pandemic. So we want to make sure that our children are up to date. And pediatricians, as Dr. Messina had mentioned earlier, really have worked hard and all physicians, the hospitals, to make the hospitals and the offices safe for families to come to be seen.
And a colleague of mine had made a very good note saying that there are a lot of parents out there who are afraid to bring their children into the ER or doctor's office. We can stress it until, we turn blue in the face, but is there any other way to give these parents reassurance?
Well, we are offering, many of us are offering telehealth as well. And a lot of times that's a great way to get started in communicating with your provider and your pediatrician. So to start there and see whether or not you need an in-person visit, your child needs an in-person visit. I think that, as Dr. Kurtz mentioned, also making mask wearing a norm and just making it just part of your normal routine with your children will really help for whenever you have to go anywhere.
That's a good point.
And could I add, we're doing a lot of waiting in the car, and we'll text you when it's your turn kind of thing, so that
Mhm.
everybody's not in the waiting rooms all together, whether it's the ER, whether it's the primary care visits. Most places are allowing people to wait in their car, and they'll text them when it's their turn.
Interesting. And Dr. Messina, I'll let you answer this question. Dr. Emanuel, you had stated kind of just letting your kids know about how to prepare and putting those masks on, but what other aspects out there do children need to know? How can parents prepare them as they are getting ready to enter school?
Well, I think, once the children are comfortable wearing the masks, and I think that's probably the biggest change that they haven't worn masks to school before. So I think that's really the biggest thing, just getting them used to that. Then next, probably, I would say that the number of times you need to wash your hands is probably a little more than a lot of children usually are used to. So I think practicing doing that is also very important. Making sure that the children understand that before you eat, before you touch your mouth or your nose and things like that, that it's very important to use that hand sanitizer, and then show them how to do it. Show them how to put the hand sanitizer in their hands and have it cover their whole hand, all of their fingers, the back of their hands. Sometimes it's just a simple rub together that the kids think is appropriate, but that needs a little bit of instruction. It's not hard, but they just need to be shown.
Yeah, maybe some adults as well.
Exactly.
And Dr. Kurtz, when it comes to symptoms in these children, what do we need to look out for? Will one child show, do children show more symptoms more so than adults, or vice versa?
Children are showing symptoms less, and it can be hard. I mean, the typical is going to be fever, cough, runny nose, upper respiratory infection kind of things, but it can be difficult. Sometimes it is diarrhea, sometimes some abdominal cramping, or some nausea and vomiting. I think you just need to have a high index of suspicion. You also have to be careful about if other people in the household are sick. You don't want to, if mom is sick, you don't then send the kid to school. But yeah, unfortunately, COVID can show up with many different symptoms, but usually children's symptoms are far more mild, and they're bouncing back much faster than adults.
And Dr. Emanuel, question for you. We just recently ran a story yesterday stating that some people are developing rashes inside of their mouths. Is that common with children as well? Have you seen any cases like that?
I have not. We are concerned about what's described the multi-systemic inflammatory syndrome that does present with rashes and red eyes, shock, and starts often with GI symptoms. So we are concerned about that in the spectrum. But I think one thing that we've learned about COVID is it is very varied in its manifestations, both in children, particularly in children, but also in adults. And we are still learning about this virus every day. So I think families, as Dr. Kurtz mentioned, we have to really have a high index of suspicion, and most importantly, keep your child home if they have any symptoms until you've verified really what is happening.
And you had made an interesting note, that we're still learning about this virus. If we had the crystal ball, that would be glorious right now.
Yeah.
But does it seem, at least from the research, from what you're hearing thus far, that children may recover faster than adults?
Well, we know that children in general are less symptomatic. They're certainly getting infections less frequently in the younger age group, and have less symptoms, only accounting for about 2% of all hospitalizations in our state. So yes, they do tend to have milder illnesses and recover. I think an important point for parents that maybe some of my colleagues want to talk about is really children with special needs, the high risk groups that families really have to pay attention, and that's a harder decision in terms of going back to school if your child has diabetes, if your child has a chronic immune problem. Those children we have found have higher symptomatic disease.
Interesting. And Dr. Messina, this question for you, when it comes to exercise, nutrition, does any of that play a role into if a child will contract COVID-19, how a child will recover from the virus?
Well, I think in the general sense, the healthier you are at baseline, probably the less risk of severe disease you will have. But certainly those things are important for the recovery of any disease, really. I think that in terms of acquisition of the disease, even if you were the healthiest child on earth, I still want you to wear your mask, because not getting a disease is always better than getting it. So I think prevention needs to be key, no matter who you are, no matter how healthy you are at baseline. This is a disease that you would really rather not have. So that's very important.
And we've heard reports from multiple people that, and experts to go with that, taking certain vitamins will, decrease your chances of catching this virus. Is there any validity to that?
I think that they are doing, there's not enough, I don't think there's enough data right now. I mean, people have talked about vitamin D, but I don't think there's enough data. I have not personally seen any good data about specific vitamins.
Yeah, I would have to agree with that.
Yeah, it couldn't hurt, but we don't know if it helps.
Yeah, right. Wear your mask.
Wear your mask.
Yeah.
Wash your hands.
So simple. So absolutely simple. Dr. Kurtz, this question goes to you. If you're a parent and you send your child to school and they come back and they've contracted the virus from school, what should that household do?
They'll need to quarantine at that point. See who else develops symptoms. You can be asymptomatic and you can still spread this to other people. So there's a quarantine period. Right now, the CDC is suggesting 10 days, I believe, is the most recent suggested for quarantine time. But they need to be, again, careful at home. And if that does happen, then there should be some mask wearing at home. Cleaning of shared surfaces at home. You want to make sure not to spread it around to all the other siblings or to the parents, because really it's the parents, the grandparents who are most at risk.
Mm-hmm. And Dr. Emanuel, if a child comes home from school and you think that maybe they may have been in close contact with somebody who has COVID-19, should they go take a test immediately? Should they quarantine?
I think that if a child is symptomatic, they should be tested for sure. And if a family is positive, it would be very beneficial to get everyone in the family tested if there's a member of the family. And if there's a member of the family or a close contact, we are not recommending, if it's just a routine contact, for example, at school, we're not recommending that child would then be quarantined. But we're hoping that we're going to kind of cohort in small groups, and perhaps that small group would not come to school until it was determined what was happening. I think that that's going to be the individual plans that schools are really working on, is how they're going to deal with a positive test within a classroom.
I mean, when you have little children coming together, with them doing one of these in the classroom, that just, makes your anxiety level go up. What if you have a classroom of kids who it spreads like wildfire and you've got, let's say, 10 students who test positive? Does that whole classroom shut down? Do you know what happens there? And Dr. Messina, I'll let you answer first.
Well, yeah, this is a situation that the schools are, they're considering. When you have a lot of COVID in the community, the chances are pretty high that somebody is going to have it and go to school at some point, and that's unavoidable. But I think that what the schools are anticipating is that when this happens, they will have some method of doing some kind of remote schooling or some online version of school, so that those kids that may be healthy at home but are waiting out their quarantine period will still be able to get instruction. So the schools are having to learn to be quite flexible in their online and their in-person instruction so that children don't get behind. And that's been a challenge, but it's something that I think all of the schools around here are thinking about.
And Dr. Emmanuel, is it, when it comes to transmitting this virus, is it more likely that a child can transfer it to an adult, or more likely that an adult can transfer it to a child? Or is this virus just, I'm going to pick whoever's the easiest target?
Well, there is, again, we don't have all the information. We really don't have enough information, but a recent study that's been quoted out of South Korea, it looked like younger children under 10 are not necessarily transmitting it as readily to adults. However, the 10 to 19-year-old age group tended to bring it home to family members, at least as well as adults did, if not maybe a little better. It's only one study. So it appears that young children maybe not, but certainly after age 10, it looks like they can transmit the virus as well as adults.
That's interesting. Haven't heard that one before. And Dr. Kurtz, this question for you, what kind of cases are you seeing with kids who have gotten COVID-19?
To be honest, it's been pretty positive when it comes to the kids. So usually what's going on is the whole family's coming in. One person is pretty symptomatic. Other people have mild aches and pains, and then the kid has practically nothing. And that's overwhelmingly what I've seen with children. Not that the kids can't get sick, especially your kids. The ones I've read about that have had bad experiences, stuff like cerebral palsy, things where they really cannot breathe as well as they ought to be able to breathe. But in general, a young, healthy kid usually stays pretty healthy in the children I've seen so far. They are more likely to be asymptomatic.
Oh, wow. And so have you seen a rise in cases in kids?
I've seen a rise in cases in everybody.
Mm-hmm.
Yeah, doesn't discriminate.
No.
Yeah.
Wow. And so do children typically recover faster than your adults? And Dr. Messina, I'll let you answer this one.
I think on the whole, yes. I've had similar experience with the children being the most likely to be either mildly or even asymptomatic with this illness. So when you don't have any symptoms at all, obviously there's really no recovery to even do. Those kids still have to be isolated, of course. They're still at risk to spread the disease, but generally speaking, they do quite well. Now, again, that's not to say that it cannot be a severe disease in children. It certainly can. It's just the likelihood is less.
For all of you doctors, does that give you a little more anxiety when I'm hearing you say that a lot of these kids are asymptomatic, which they just could be walking around, nobody knows?
Right.
Bring some fear into you?
Well, I think that's the key to the mask wearing. Everybody has to wear them because you don't really know who could be infected and who couldn't. So the best strategy that I tell my own kids to take is just assume everybody might have COVID and proceed like that. So the universal masking is really key to that problem.
You don't have the crystal ball. If you did, you would have the winning golden ticket.
Right.
How long do you think, or how long would you want parents and kids to know that we need to wear these masks?
At this time, for the foreseeable future, I think is probably the best answer to that.
We have to get to a level of immunity in our population that we are nowhere near.
Right.
That herd immunity number that we talk about, which is, I don't know, 70, 80%.
Right.
And we're probably at 10%. So we have a long way to go. And so, yeah, we need to prepare our kids accordingly.
And we're wrapping up on time, but I want to ask each of you doctors, and I would love to get your thoughts on this. What is your biggest concern as we head back to school with these kids? And Dr. Messina, I'll start with you.
My biggest concern is that if we go back to school when rates in the community are high, we're going to see a lot of disruption in schools. There's going to be a lot of kids that have to quarantine, or kids that are absent for whatever reason, even if they themselves aren't sick, maybe a family member is sick. So I think that school is going to be much different. There's going to be a lot of learning in school as well as online, and a lot of flexing between the two. And that may be hard for some students who you know, have a difficult time with change like that.
Dr. Emanuel?
You know, I think we're all concerned about when the flu season comes, that when we have a double hit. But I also want to just make the comment that as a community, I think what Dr. Messina said in terms of having to be flexible, and we really need to help our schools and help our parents that have young children in school figure out how we're going to be flexible and go back and forth. So I think those are the two important things. I do worry about influenza.
Dr. Kurtz?
I worry about the asymptomatic kid bringing this home to the grandparents. You know, I think we all need to take a look at some of the habits that we have. Now's not a time to finish your kid's juice. You know, stuff like that. Things that we've always done and never thought a single thing about. You need to be a little wary of that. And it's not that you can't have, I think, grandparents watch the kids after school, but I think you should strongly consider maybe they should wear a mask. While they're white, because it's okay to wear a mask at home. You know, this is just about keeping everybody safe, well, as safe as possible until we do find either a vaccine or herd immunity. You know, as healthcare professionals, we're staying focused on being prepared for whatever walks into our doors. But as parents, you need to stay focused on being prepared for whatever walks in your door too, and protect yourself and your family members that are at risk.
What is the likelihood, Dr. Kurtz, if you do have to have your children, you know, be watched by somebody who has immunodeficiency, or their grandparents, they're the elderly, if they do wear a mask, what's their likelihood of contracting?
Less than if they don't.
Right.
We don't know the numbers, but mask wearing is effective.
Perfect. Doctors, I thank you for your time so very much. Is there anything extra that you would like to add out there? Let people out there know before we head out.
Just, I think we're all in this together, and we're going to continue to learn and to not be put off by the fact that sometimes recommendations change along the way. I think as we learn, we make there's a change to recommendations, and I think sometimes that can be off-putting, but that is what the new normal, I think.
Yeah. Dr. Kurtz, any last words?
No, I absolutely agree with that. And just know that, you know, your hospitals are focusing on being prepared to take care of you however we can. You know, you guys take care of yourselves, and this is not going to be over in a couple months. You know, we will get through this together, and we'll get through it together if we help take care of one another. Dr.
Messina?
Just want to reiterate that your mask does not only protect you. In fact, your mask is really, it does its best job protecting others. So if you have people in your life, like Dr. Kurtz mentioned, grandparents, people that live outside of maybe your immediate home, but they're at risk, even if they're your relatives, wear a mask. You know, this virus spreads between family members just as it spreads between strangers. So that's really important to protect those that are most vulnerable.
Wonderful. Doctors, thank you so much again for your time. I know that you're busy. Thank you for the work that you guys are doing out there to keep us all safe. And thank you for reiterating the hand washing and the mask wearing. Thank you.
Yes. Thank you very much.